Welcome, and thank you for your interest in supporting peers and raising knowledge in San Diego, or Spark SD. Spark SD is a new program for those working in caregiving with older adults, offering in-person networking opportunities and online peer-to-peer support to build connection and share knowledge for those working in the field of aging in San Diego. The idea for Spark SD grew out of SEAL's work with caregiver training and peer support programs. A few years ago, SEAL launched the San Diego Caregiver Connections, which was a groundbreaking initiative that offered free, competency-based courses, peer support, and career pathways to individuals interested in working in the field of aging. The San Diego Caregiver Connections included training courses to enhance caregiving skills and provide essential knowledge, along with a very unique feature, which was peer support networks. These networks offered opportunities to build community, share experiences, and provide emotional support to each other. We saw firsthand how powerful peer support could be, and how it helps people to feel seen, supported, and less isolated in their roles. In our peer support programs, we thought that most of our attendees would be family or friend caregivers, but there were several paid staff from various organizations that work with older adults who also needed a place to connect. It made us think, what could happen if we brought a similar kind of connection into local organizations where people are working with older adults? So we got to work. We researched peer support programs at other institutions to inform our approach. At UCSF, they have a program called Caring for the Caregiver that offers peer support from trained, unpaid professionals across a range of clinical roles to help staff navigate difficult experiences. UCSD also provides a program similar that's specific for physicians, as they recognize that sometimes physicians prefer peer support over formal mental health services during times of stress. Finally, at USC's Keck School of Medicine, their program has a peer support and emotional support hotline that is staffed by volunteers from the Department of Psychiatry and Behavioral Health that can help to support caregivers. What came out of that research is that we could not find a program that involved multiple organizations working collaboratively within a geographic region. Spark SD would be a new approach that could serve as a national, scalable model. In the fall of 2024, we had the opportunity to gather staff, professionals, and caregivers in the field of aging in San Diego together for an in-person meeting. Our goal of this meeting was to gauge how interested these staff would be in actually creating a peer-to-peer support network and to engage in networking events. So we gathered staff from Jewish Family Services, Serving Seniors, St. Paul's, and of course our staff from SEAL. And what we found is that the attendees were really excited about having the chance to connect with their peers who are doing similar work in different settings. One thing that we recognized during this event was that people working directly in the field often don't get the same opportunities to connect with their peers as those who are in administrative or higher level roles within their organization. And that poses two really big challenges. First, they may not be aware of the full landscape of services and resources that exist around them in San Diego. And second, they may end up feeling really siloed or isolated. Sometimes when you're so busy with your work, it can be very easy to silo within your own organization or even your own department. After this really positive experience with the in-person meeting with these three organizations plus SEAL, we conducted a survey to ask participants why peer support could be valuable to them in their role and to their organization. And these are some of the results that came up. First and foremost, people were really excited about the opportunity to learn from one another in both formal and informal settings. An example of formal learning may be something like having a professional or expert come to talk about a particular topic during peer support, while informal learning may be something like having the opportunity to swap stories or talk about challenging cases at a networking event. People were interested in coming out of their silos and working together across organizations to share tools, best practices, and tips for improving patient care. Many people get into the field of aging because the work is not only impactful, but it's also meaningful to them. At the same time, this work can be really challenging. One thing that was highlighted over and over again in this survey of participants was that they were interested in finding a way of supporting each other through those challenging times. What we know is that burnout occurs when people are in environments where they feel unseen, unheard, and unsupported, where they feel like they have minimal control in their day-to-day work. So one thing that was again highlighted in this survey was that people thought that by having support, there'd be decreased burnout and in turn, decreased staff turnover. Let's take a closer look at staff retention. Staff retention is critical, not just for continuity of care and positive patient outcomes, but for the overall well-being of the organization. When staff feel supported, they're more likely to stay, to show up fully, and to contribute to a healthier workplace culture. What's important to highlight is that offering support for caregivers is often far less expensive than the direct and indirect costs of turnover. Things like recruitment, interviewing, onboarding, and training of a new staff member all cost staff time, coordination, and out-of-pocket expenses for things like recruitment. Indirect costs of turnover can also add up really quickly, from lost productivity due to the staff member leaving and others having to pick up the workload, to the time that it takes to ramp up a new hire. Sometimes people don't feel completely autonomous in a new role for up to 3 to 6 months after they start in a new position, which can lead to disruptions in service that affect both staff and the people that they serve. But turnover doesn't just impact one position. It often creates a ripple effect throughout the entire organization. We see what's called the turnover contagion, where when one person leaves, others start to question their own role. Workload shift to remaining staff, which can often lead to burnout and frustration, morale drops, and over time, valuable institutional knowledge walks out the door. The impact is deep and wide-reaching. And that's why retention efforts matter so much. Investing in support now for our caregivers can prevent much bigger losses down the line. All right, so all of that aside, what else did we hear from participants? Well, participants highlighted that there were really important topics that they wanted to explore in the networking events and/or at their peer-to-peer support groups, including things like emerging challenges and trends in the field of aging. They wanted to learn more about insurance and benefits, cultural competence and cultural humility. They wanted to explore opportunities like case studies and best practices. And one thing, again, that was highlighted repeatedly was interest in learning about end-of-life care. I will say, too, this does tend to be one of our most popular caregiver training courses from our San Diego Caregiver Connections. Another important takeaway from the event was around the format. Many people shared that they have a preference for a hybrid model, combining both in-person and online opportunities to connect. That flexibility makes it a lot easier for people to participate in a way that works for them. So with all of this information from the research, from our own personal SEAL peer support experiences, and from the feedback from potential participants, we officially launched our one-year pilot program called Spark SD. So what will be the structure of Spark SD? Spark SD will offer quarterly in-person networking events that allow individuals who are working in the field of aging in San Diego to meet face-to-face to build relationship and exchange ideas. We will also have virtual monthly peer-to-peer support groups, which will allow for more deep sharing, reflection, and support in a private setting. All of these events will be a drop-in model, so come and do what works best for you. Our peer-to-peer support groups are going to have opportunities for people to share experiences, offer advice, and give emotional support. Again, this is a chance for caregivers to feel understood and less alone. One key note here is that these groups are typically led by peer facilitators. If you're interested in being a peer facilitator, please check out the SEAL website and sign up for training. So if you've watched all the way to this point, we are very excited to have you join Spark SD, where we're fueling connection and lighting the way forward.